Welcome to Your Health. Joining us in this episode is Dr. Kayla Dupre, a hospitalist at Terrebonne General Health System. Today we will be discussing the flu and RSV, how to protect yourself and your loved ones from getting sick this season, and treatments that are provided. Welcome to the show, Dr. Dupre.
Thank you.
All right, well, let's get started with you telling us a little bit more about yourself and your role at Terrebonne General.
Sure. Well, I'm a Houma native, born and raised. I did my undergraduate at Nicholls State University, and then I went on to Shreveport, where I actually got a board certification in both internal medicine and pediatrics. I came here to Terrebonne General, where I signed on as a hospitalist, where we admit most patients who come into the hospital when you get sick.
Okay, good. So you see hospital patients.
Yes, ma'am.
All right, well, the flu and RSV, it's that time of the year, right? So tell us, what is the flu and what is RSV?
So influenza and RSV are both actually viruses, which they're submicroscopic infectious disease particles, right? They get inside your cells and make you sick.
Not fun. Right?
No.
So what are the symptoms and how can you tell them apart, or can you tell them apart?
Sure. Sometimes the symptoms are actually indistinguishable from each other. Oftentimes we have muscle aches, headaches, fevers, chills, snotty nose, cough, and congestion. So all your typical cold symptoms. What makes these two viruses unique is oftentimes or sometimes they cause respiratory distress in individuals too. So they're ones that get people actually really sick sometimes.
And how is the flu and RSV transmitted?
So respiratory droplets is the main way. So you cough, you sneeze, and you're standing next to someone who's sick, you get it. But also it tends to stay on everything we touch. And that's a big way too. So going to the grocery store, you're touching groceries, putting them in your buggy, that's a way to get sick too.
So I know something that you need to do in that case, right?
Yeah, exactly.
All right. Well, how severe are the viruses and how long do they last?
Sure. Most people who get sick with flu and RSV do very well. Like I said, oftentimes it seems like a cold bug. They typically last 1 to 2 weeks, although sometimes the cough, especially with RSV, can last 6 weeks or more sometimes, which can be quite disheartening for parents especially, and even you if you're trying to go back to work and everyone's looking at you when you got a cough. So
exactly. But are you still contagious when you're coughing? Or
typically, once your symptoms start to improve, and as long as you've been 24 hours without a fever, it's usually safe to return to work, just taking standard precautions.
Okay. What are some common misconceptions about who can get RSV?
Sure. So RSV in particularly has been known to be an illness of childhood. So for a while, most of the time, people associate it with illness of children, little babies. And you probably heard the Don't Kiss the Babies campaign, especially during cold and flu season. And RSV is one of the reasons. But actually, in particularly adults, especially the elderly above the age of 65, or folks with cardiac disease or diabetes are in particular at risk for developing RSV and getting pretty sick from it too.
And are you seeing more cases of older population with RSV?
Lately, yes, we've had several cases of hospitalized RSV adults.
Okay, but we do have the means to treat them. So how can you prevent, or what are some methods to prevent RSV?
So the big ones is washing your hands as frequently as you think about it, washing surfaces that we touch frequently, and then staying home when you're sick, keeping your kids home when you're sick, and trying to stay away from big crowds and maybe people who might be sick as well.
And the flu shot, how can that prevent the flu?
So the flu shot is almost like a primer for your immune system. You get the flu shot and your cells develop antibodies that can be stored in your body and as memory for if you get sick with the flu, so they can fight it off a little bit easier. The flu shot doesn't always mean that you won't get the flu, but it certainly can make the flu less severe.
Less severe. And so what are the benefits of the flu shot?
So benefits of the flu shot include shorter course of illness, sometimes prevention of illness altogether, but also it's been shown to decrease hospitalizations and decrease severe illness, especially in those select populations of people with diabetes and heart disease.
So it is beneficial to get it?
Absolutely.
Okay. What are treatments provided to patients admitted?
Typically, treatment is supportive in many ways. We provide oxygen and fluid management for those who are dehydrated or maybe have a little extra fluid on them. But there are antiviral treatments that we often prescribe, like Tamiflu for the flu, that actually decrease the duration and sometimes even the severity of the illness, although sometimes typically just by one day. But usually they need to be started quickly and early to get that benefit too. RSV has some less accessible antiviral medications that we often can't get, but in select populations, especially like neonates, there is preventative medications as well that we can provide, although not a vaccine for RSV.
Okay, so what's a main tip that you want to tell people out there to keep their families healthy?
So the big thing is if you're sick, stay home. Wash your hands as frequently and often as you think about it and can. Use hand sanitizer, and then wash those surfaces that we touch, those computers, those phones, and tabletops. Wash all the things that we touch as frequently and often as we can.
Okay, thank you so much for sharing all this information with us. For more information about the flu and RSV, visit tghealthsystem.com. Thanks for being with us on To Your Health. I'm your host, Rhonda Alfred, and I'll see you right back here next week.